All right, there we go. I think we're all set. So
Yep.
thank you, Angela, for the introduction there. And I'd like to say it's great to be back at this meeting. We're all not there physically, but it still always is a meeting I look forward to. And I was very happy when I first joined that John Luker was here because I haven't seen John in a while, and it's great to see you, John. And there's also some other participants here that I see as well that are also glad you can join us. So I'm going to get started with a little overview here on foodborne illness outbreaks in New York State. And, you know, a lot of the information I'm going to go over is going to be similar to stuff you've seen in the past. Couldn't really do much because of this wonderful thing called COVID and trying to update our data, but we'll go over some of that stuff. And I want to leave a lot of time at the end for questions, and we can have more of an open discussion if you guys have questions or anything like that. So we're going to talk about the background of foodborne disease outbreaks in New York State. We'll talk about foodborne disease surveillance, give out some outbreak examples, some information on purchase history and how we use it, why we use it, and how we go about collecting it. And then we'll leave time for questions. So each year, roughly 48 million illnesses, 128,000 hospitalizations, and 3,000 deaths happen annually across the United States that are associated with foodborne illness. This was data that was collected from several different resources. It was done by several different contributors of looking at research of different data sources in order to determine this estimate, and it seems to be pretty well accurate as of today. Foodborne disease outbreak investigations are what we refer to a three-legged stool approach. It involves environmental health, epidemiology, and laboratory. We try to push for communication with all three of them to work together, communicate together in order to get the job done. And that's something that we've always been pushing for in New York State. Environmental health focuses on things like conducting evaluations at food service establishments, reviewing food preparation procedures, conducting staff interviews, collecting food or environmental samples, and then implementing interventions. But we're also involved in doing a little bit more work in trying to get at what is the whole environment? What did the person consume? What do they purchase? What makes up that environment that we need to look into? On the epidemiology side, we look at cases specifically, we look at case definitions, develop questionnaires, conduct interviews, calculate statistics, develop curves, and try to collect stool samples or stool specimens. On the laboratory side, we look for sample analysis. PFG matching was something that was done, but it hasn't been done in a past couple of years, and now we're switching to use of whole genome sequencing, which you'll hear about a lot. So foodborne outbreak is defined as the occurrence of 2 or more cases of a similar illness resulting from the ingestion of a common food in the United States. There are some other states that may use a different definition. They'll say 2 or more within 2 or more cases outside of the same household. In New York State, we don't do that. We use the definition that CDC uses, and I'll give you an example why. Is the husband and wife goes out to dinner, they go and eat raw shellfish, they both get sick, they both end up with Vibrio. Technically, that's a foodborne outbreak. They're both from the same household, but it's a foodborne outbreak. So there are things that we need to look at to determine if there are people within the same household and if it's a true outbreak or not. Prior to 1992, there used to be single case incidents that were referred to as outbreaks, but that definition changed in 1992. This gives you an overview of how outbreaks are investigated in New York State. We basically follow on 2 different pathways, and we've got several of our partners listed here, from local health departments, environmental health, communicable disease staff, our New York State Department of Environmental Conservation partners, our agriculture and partners, and I just realized I need to change that acronym because I think we're switching to NYS AGM. United States Department of Agriculture, Food and Drug Administration, and the Centers for Disease Control and Prevention. So our other partners are constantly involved in communication in regards to our outbreak investigation. If we see a food item that may involve one of our partners, we notify them right away. So the typical outbreak investigation is a complaint comes in. A lot of people are getting married, you know, this time of the year. You go to a wedding, everybody says they got sick, and they file a complaint. That's a complaint-driven type investigation where they'll notify the local health department. Here we have our regional offices help coordinate information from the local health departments. Central office level, we will work with them and try and assist them with the investigation. And then we'll reach out to our other partners, our state partners or our federal partners if needed. The other pathway is what we call the lab-driven pathway. That's when an ill person goes to a doctor. The doctor takes a stool specimen, the specimen goes to the local lab gets an isolate, sends that to our state lab. The state lab identifies that this person may be related to a number of other cases across the state or across the country, and they'll notify our central office. And that's where we come in and we try to find out what made this person sick. And we've got 6 or 7 people that are highly related that we're going to need shopper card history for them. So that's when central office will work with our other state and federal partners and our industry partners as well, and try and get information to identify that possible source. So those are the 2 main pathways that we see in foodborne outbreaks. And now we're going to take a look at foodborne disease surveillance in New York State from 1980 to 2019. So here you'll see a number of foodborne outbreaks in New York State. And we see this rather decreasing trend. We had a large number of outbreaks in the early 80s, which were often attributed to outbreaks with salmonella and eggs. We also had a lot of outbreaks associated with viruses, shellfish, and handling by an infected person. And this next slide here, we can see this large increase in outbreaks. Prior to 1992, there's several outbreaks. Then we see this big drop here in 1993. The one significant change that happened here is the bare hand contact prohibition law. So in New York State, you're no longer allowed to handle ready-to-eat foods with your bare hands. So after 1992, when this law was implemented, we saw this drop. Now, the one thing I did bring up is, yes, the outbreak definition did change in 1992, where it was no longer a single case, but we excluded the single case incidents from this data here, so that it would be, 2 or more cases across the board. So really that bare hand contact law implemented a change. In 2003, it's more fun when we're in person. That was the year I started in foodborne disease, so that's when that dropped. 2009 is really interesting, and you'll hear what I mean by that, by why, because 2009, we see a huge decrease in outbreaks. What happened in 2009 was H1N1. That was a big, the big epidemic we're dealing with H1N1. Now we've got COVID. So COVID really hit us in 2020. There's not a lot of data out there for 2020 right now, but a lot of us know firsthand, including myself, we've been pulled into so many different directions and resource-wise. We all know and we all feel that that number is going to be very low. And I can tell from the number of complaints that I received, the number of reports that we were investigating, because they still went on, but there was very few. So we're going to see a large drop in 2020 once that data is finalized. The reason is going to be due to resources. There was a number of resources of people that were pulled off of their regular duties and sent to do COVID activities. However, what else are we going to see in 2020? There was not a lot of people going to restaurants. They were shut down. There was not a lot of food being eaten outside the home. There were consistent with gastrointestinal illness that were also considered symptoms with COVID. So there could have been the assumption if somebody had vomiting or diarrhea, they had COVID, they stayed home for 14 days or now maybe 10 days. And they didn't go to a doctor, they didn't get tested. So that information is going to impact our foodborne disease outbreak surveillance data. So it'll be interesting to see when those numbers are finalized. So here we'll look at the top 10 foodborne outbreaks in New York State from 2005 to 2019. Our number 1 pathogen is the unknown pathogen. That's the outbreak that we can't seem to identify the etiology. That's because we're not able to get stool specimens from the ill complainants. We're not able to get them to cooperate in the investigation. I mean, I've had to do it. You want to hand a person a cup, say, here, please poop in this, and we'll send it off to the lab. And people really don't want to poop in a cup. It's hard to try and entice them to do that. Norovirus is the leading pathogen that we know about in foodborne disease outbreaks in New York State, followed by Salmonella, Scambritoxin, E. coli, Clostridium perfringens, Campylobacter, Listeria monocytogenes is there as well, our Vibrio and our ciguatera. Vibrio is something that's interesting. I've literally been bombarded the past 2 weeks with Vibrio cases. Well, I say I have no idea why. I mean, I've got theories that I'm wondering if it's due to the storms that we've seen, across the country and in some of the, impacting some of the waterways where a lot of our shellfish comes from. That's a good possibility, but I think that needs to be proven. But yeah, we've seen an uptick in Vibrio cases in the past couple weeks. Our norovirus outbreaks are mainly associated with infected food workers, people going to work while sick. Now we have a tough time with people actually going to work at all, period. But we're still seeing some of those types of outbreaks. What's interesting too is given COVID times, a couple of outbreaks that we got at the beginning of the year were people using too much not hand sanitizer, I'm sorry, too much disinfectants and leaving residues on food contact surfaces, and then the food would contact them and people would get sick. So we had a couple of chemical outbreaks out there as well that were this year. So here we're looking at our foodborne outbreaks by etiology in New York State from 2005 to 2019. The majority of the percentage of the outbreaks, a large percentage, are the bacterial outbreaks during this time period, followed by unknown. Years ago, it used to be unknown was the large percentage of our outbreaks, and then viral, and then it was bacterial. But we're seeing an increase in bacterial outbreaks. The reason why is likely due to our technology, due to the use of whole genome sequencing, due to the use of better laboratory procedures. There's also things going on at local labs that are using what we call CIDT tests, which are culture independent diagnostic tests. They're readily available, they're easy to use, they're quick to use, and people are getting results back much faster, which look like we're getting more positives, and we're identifying possibly more outbreaks from those tests. Here you'll see the number of foodborne outbreaks by etiology again. As we kind of basically discussed, viral is also looking like a big thing in 2019. It's overcoming our unknown. So we had a number of our viral outbreaks in 2019. We had some chemical outbreaks. We had very little parasitic outbreaks. I think the last one was around 2018-19, around there as well. Here are the number of foodborne outbreaks with known etiology for 2019. So just looking at that 1 year, a majority of our outbreaks, as we saw in the other diagram, were the viral outbreaks, were norovirus, followed by Salmonella. We had 4 Scambritoxin outbreaks, 4 Campylobacter, 4 Clostridium botulinum outbreaks. We've had some E. coli shigatoxin producing outbreaks as well as some other outbreaks that are not on here. The Scambritoxin outbreaks, we've seen some Scambritoxin every year. We do see some in New York City a lot, where there's a lot more fish purchasing and the readily available fish markets. I think it was not last year, it was probably 2018. We had a multi-state Scambritoxin outbreak that was involving waters from, I believe it was Vietnam, where the sources were traced back to that area. So we had fish coming in that was either decomposing prior to it got to the store, or wasn't kept at the right proper temperature. So we do see some Scambritoxin outbreaks every year. Our Salmonella outbreaks, a lot of them were multi-state outbreaks as well, and our norovirus outbreaks again are mainly associated with the infected person, which we'll see here in the contributing factors slide, looking at the top 10 contributing factors in New York State over this 15-year time period. The contributing factors, number one for many years was the infected person. That was a top contributing factor, but now it's being overcome by contaminated ingredient. I had a conversation with Jack Gazayich, and actually he wanted to take a presentation. Jack used to work with the New York State Department of Health many years ago, and then went on to FDA and retired from the FDA, but he still is involved in some of this research as well. And back, for many years, the infected person was the #1 contributing factor. But if we look at some of our trends, a lot of our trends, and we look at foods being recalled, a lot of them are regarding contaminated ingredients. There are foods that are coming in that are contaminated that there's not a kill step for. Our seeds, a lot of our peanut butters, a lot of our items that don't need to be cooked. They may come in contaminated. There's nothing we can do about them, and those are contaminated ingredients. Even some of our, if they contaminated or ground turkey and it is then inadequately cooked, you'd have more than one contributing factor identified for that outbreak, but both of those played a role as a contributing factor in that outbreak. Natural toxicant is mainly our scombrotoxin type outbreaks, where something comes in with a natural toxin that's already contaminated. Inadequate cooking, we discussed some of that there. It's when the product is inadequately cooked. Improper cooling is when a product is not held at the right temperature for cooling or is not cooled in the right amount of time, which allows for proliferation of the bacteria to survive. And we do see that often in some of our outbreaks as well as some of our establishments. Consumption of raw, lightly heated food of animal origin. That's where we see some of our food items that are being consumed raw, and they may have been intended to consume raw. Some of our raw shellfish, some of our burgers that are ordered rare, or other food items that are eaten raw. Hand contact with implicated food. And as we mentioned, we saw infected person. So wherever we see infected person, that may or may not involve hand contact. So because we could have an infected person that's identified as the source of the outbreak, however, we can't determine if they use their bare hands or not. So the hand contact may not be identified in that. Excuse me. We may also identify an infected person who may have contaminated utensils, which then contaminated the food. So not every time we identify infected person are we going to identify hand contact. However, for every hand contact we identify as a contributing factor, that does involve an affected person. So all of these 36 are included in this 129. Excuse me. So those are basically our top 10 contributing factors over that time period. So now we're going to look at the specific contributing factors identified in bacterial outbreaks. So if you see the contributing factors associated with bacterial outbreaks, you have several identified. It's because a number of our procedures could impact a bacterial pathogen. We could have contaminated ingredient, we could have inadequate cooking, we could have improper cooking, we could have inadequate hot holding, you could have preparation several hours before serving. So a number of those contributing factors could be identified. And there's also the ones that we don't identify. Here you'll see, the contributing factor was unknown in 187 of the outbreaks. However, the most identified contributing factor associated with a bacterial outbreak, as we mentioned, was contaminated ingredient, and then followed by inadequate cooking for the ones that are known. When we look at viral outbreaks, there's only a handful of contributing factors that are typically associated with viral outbreaks. It's mainly the infected person and the hand contact, but there are incidents where we'll get contaminated ingredient that comes in. This is often where we see some of our hepatitis outbreaks with frozen berries coming in already contaminated, or products coming in already contaminated from the field. So those would be other factors that are associated with viral outbreaks as well. The top 10 significant ingredients identified in New York State in foodborne disease outbreaks. Finfish has been the #1 ingredient that we've been able to identify. A lot of that has to do with our number of scombrotoxin outbreaks. It's kind of easy to identify the food vehicle when we're dealing with scombrotoxin. So that's why finfish is often identified, because it's right then and there. Poultry's been another top ingredient, as well as beef, starchy foods, fruit or green leafy vegetables, shellfish, other vegetables, and dairy. These are the main ingredients that have been identified in foodborne disease outbreaks in New York State during this time span. When we look at the method of preparation identified in foodborne disease outbreaks, the majority of our outbreaks are associated with cook serve foods. Those are the foods that you're supposed to cook and serve right away. Those are our hamburgers, our hot dogs, our grilled chicken, other chicken dishes, things that are cooked and served right away. There's not a holding step. You're not going to hold it for 2 days. Some of our fried food, stuff like that. Foods eaten raw or lightly cooked is another method of preparation that is often identified with outbreaks, followed by solid masses of potentially hazardous foods. An example of that is, your large casseroles, your large concoctions of foods that involve multiple layers or multiple food items that may be involved into a solid piece of food. Our salads with raw ingredients is another top food item, followed by roasted meat or poultry or natural toxicants. Multiple foods, commercially processed foods, liquid or semi-solid masses of potentially hazardous foods, and then sandwiches is also another method of preparation. And as we went through some of these, I mean, you could try and make the association between the method of preparation, the significant ingredients, and the contributing factor. Some of our cook serve foods, the method of preparation is cook serve. That's often associated, like I mentioned, with our beef products, with our poultry products, which are going to be often associated with contaminated ingredients coming in contaminated and inadequate cooking. Our sandwiches are often associated with our viral outbreaks. That's often associated with infected food handler. So those are things that we look for. And when we're doing an investigation and we get an idea of what the food item might be, those are the things we look for. One of the investigations we're working on right now involves a viral associated with a sushi restaurant. So automatically that makes me think of food handling. And were any of the food workers sick? So we want to make sure that we're asking about the food workers, asking about their handling practices, asking about their illness status, asking if they have a sick worker policy. And that's typical how we go through some of our investigations. All right, now I'm going to go over some of the 2020-2021 multi-state outbreak investigation examples that were made most recent. In 2020, we saw some selected foodborne outbreak investigations that were associated on a multi-state level, and this comes from the CDC website. There is some unknown source of an E. coli 015787. There is Listeria monocytogenes in deli meats, E. coli in leafy greens, Salmonella Stanley in wood ear mushrooms, Salmonella enteritidis in peaches, Newport in onions, Cyclospora in bagged salad mix, Listeria in clover sprouts. In 2021, we saw typhimurium in prepackaged salads. We saw fully cooked chicken associated with Listeria monocytogenes. We saw frozen cooked shrimp associated with Salmonella vultividen. We saw Salmonella enteritidis with raw frozen breaded stuffed chicken products. Salmonella that I'm not even going to mention, try to pronounce that name, but I think it's Duisburg, associated with cashew brie. Salmonella Hadar with ground turkey, Listeria monocytogenes with Queso Fresco, and an unknown food source with E. coli. So one of the ones that I want to go over is the Salmonella Hadar, and I'm also going to go over the Queso Fresco investigation. Both of these were investigations that New York State were involved in, so I'll go over those with a little more detail. So regarding the Salmonella Hadar ground turkey investigation, there are 33 confirmed cases as of May 17, 2021. Cases were in 14 states. In New York State, we had 4 cases. Onset dates range from December 28th to April 22nd. Age range was 1 to 92 with a median age of 49. 66% of the cases were female. 4 out of 22 were hospitalized. No one died, and 8 out of 13 reported eating ground turkey. So there was a ground turkey signal with this outbreak early on. We wanted to look more at ground turkey and see, what types of turkey did these cases consume. So testing results show that the ground turkey contaminated the outbreak strain of Salmonella was produced by Plainville Brands LLC. USDA FSIS traceback investigation identified several turkey processing facilities, and the outbreak investigation was also identified in routine turkey samples. We find all that out? Well, one of the key parts of our investigation is shopper card histories. So we were able to get shopper card history information. We're able to identify that these cases consumed turkey and that we needed to find out more about the turkey that they consumed. So that's where we involve our other federal partners. We would involve agricultural markets and we involve USDA and try and see if we can get a trace back of where that turkey product came from. And sure enough, it converged to these facilities that were identified as part of this outbreak. For Listeria monocytogenes, the Queso Fresco investigation, there was 13 confirmed cases as of May 14, 2021. There was cases reported from 4 states.
David,
New York State, yes.
may I ask a question?
Sure.
With that Salmonella outbreak, I'm assuming the ground turkey is sold raw, correct?
Yes.
So do you think the illnesses are related to improper handling and cooking?
Many of them can be. The also thing is we don't have the details of, what products everyone ate. For example, did that ground turkey, was that part of a already prepared meal? For, some of our stuffed chicken outbreaks that we've seen, it looks like it's cooked. The box makes it looks like it's cooked, but it's really not. So there are different issues involved with that. So a lot of them may be associated with handling issues. It's very difficult for, 33 people to inadequately cook ground turkey. There may be other issues involved in that where it may not have been the ground turkey that, was actually what they consumed.
Okay.
But they may have prepared it, they may have cooked it properly, but then they went and made their salads at home. Yep.
Okay.
So that's another thing to look at as well.
Thank you, and sorry to interrupt.
No, that's fine. It's not a problem. So with the Listeria monocytogenes, the onset stages ranging from October 20th to March 17th. So we've got quite a time span there. Age range was 1 to 75 with a median age of 52. 7 cases were female, 12 people were hospitalized, 4 developed illness during pregnancy. There are 2 pregnancy losses, 1 premature birth, and 1 death. 8 out of 11 reported eating Hispanic style fresh and soft cheeses. 7 out of 8 reported eating Queso Fresco. 4 specifically reported brands made by El Abuelito Cheese Incorporated, which included 2 different brands. So in this investigation, we were able to use, again, shopper card information to identify purchases, to identify sources, to identify what people may have consumed. And with the use of whole genome sequencing, we're able to identify the Listeria from these consumers and the Listeria from samples of El Abuelito brand Queso Fresco were closely related. And it's likely what got these people sick. So this allowed, or not allowed, but this led to 2 recalls being issued, one on February 19th and the other on February 27th of 2021 of El Abuelito cheese. So this is another investigation where shopper card information was helpful, as well as the use of whole genome sequencing data. So we'll talk a little bit more in detail about purchase history information. And we're going to talk about some organizations that are involved in that. So SHOP is the Shopper History Outbreak Partnership. You can find more information on SHOP on the Association of Food and Drug Officials website, and we'll go into that. Basically a group of public health and food safety officials dedicated to working closely with industry partners to use consumer food purchase data as a tool to solve outbreaks. It helps remove contaminated food from the marketplace, helps us identify the sources, which in turn helps us prevent future additional illnesses. So SHOP is a great group that I've been part of for a long time. I know several of our agricultural market partners were a part of it as well. And we're currently, developing new tools in order to help identify outbreaks and use that shopper card data and shopper card history information. AFDO has also teamed up with SHOP, and AFDO, the Association of Food and Drug Officials, has been using food purchase history to solve foodborne outbreaks. Here's an AFDO site where you could find a list of states that have statutory citations posted that can be used for obtaining consumer purchase records during investigations. They also have a nice video there about how food purchase history protects public health. You could also read about success stories and other shopper history and best practices during a foodborne outbreak investigation. So feel free to go to that. You won't find the New York State Statutory Authority on there yet because I haven't been able to put it together during this COVID times. I lost all my staff. They went on to do different things. And I'm currently trying to seek help and hire people to help get some of this other work done. So New York State will likely have their information on there, but we're going to go over that during this presentation. So why do we look at purchase history information? During foodborne outbreak investigations, public health practitioners may have an urgent need to obtain that consumer history information. We need, and it's also helpful because it assists with the interview process. It helps generate a hypothesis, it helps support a hypothesis, and it helps confirm information obtained through interview. I'll give you an example, and I always, remember this one incident where the person always swore that all they did was eat honeydew melon. And honeydew melon, that's the orange one. Well, they were under the impression that cantaloupe was honeydew melon. Their Sherpa cards in history helped us confirm. They said, oh no, I ate honeydew melon. Well, when we got their purchase history, you purchased cantaloupe. And that's all you've purchased for the past 6 months. And oh yeah, so that helps us get information. It helps speeds up an investigation. It helps us rapidly identify contaminated products. It helps us assist with traceback investigations, and as well as stop illness. So in New York State, we used to ask for a signed consent form. That used to be part of our normal process, but that slowed down our investigations. You interview a person, you get information from them, you wanted to learn more history because you're related, you're already a week into it, then you have to send them a form, you have to have them sign it, they have to mail it back to you. So that's probably going to take another week to 2 weeks, and then you could maybe get their shopper card information. So that really slowed down the process. So what we've been doing is we now ask for consent during the interview process. When the person is first interviewed for, we ask them if they will provide their shopper card information for the purpose of us obtaining their food history and learning more about the foods they purchased and consumed. By them providing us with that shopper card number, why else would they provide it to us? We would get the information and basically request that information from our grocery store partners and our other industry partners. So we would submit a request to industry partners and basically by email. The other way we would ask if there are some companies out there that do need something signed. So what we've been providing them with is a signed letter from myself that highlights their statutory citation, because that's something I can produce in a day. Where if we, again, need to get the consumer who already gave us permission to obtain that information to sign something, it's going to delay our process and our investigation. In the New York State process, how do we have that authority? Well, it's basically given to us through public health law. Under public health law, section 206(1)D, the commissioner shall investigate the causes of disease, epidemics, the sources of mortality, and the effect of localities, employments, and other conditions upon the public health. This gives the commissioner the authority to obtain shopper card history information in order to investigate those diseases. Public health law, section 206(4)A, the commissioner may issue subpoenas, compel the attendance of witness, and compel them to testify in any matter or proceeding before him, and may also require a witness to attend and give testimony in a county where he resides or as a place of business without the payment of any fees. This gives us the authority to subpoena that shopper card history information if a industry partner refuses to provide it. We've only had to deal with that once in my whole career. And it wasn't a large grocery store provider or industry partner, let's say. It was a small store that did have a shopper card program. But typically, we've never had to request a subpoena because we do have wonderful partners out there in the field that we're all on the same page and trying to investigate outbreaks and solve these and solving to these issues. Here's a couple of success stories. In 2011, we refer to this as pining for pine nuts. There's 32 New York State residents that were part of a multi-state outbreak investigation of Salmonella enteritidis. State and local epidemiology and environmental health partners were involved with their laboratory investigators, and we all worked together. to determine that pine nuts purchased from a single grocery chain was associated with the illness. Pine nuts were tested at our Wadsworth Center laboratories and found to be the same strain of Salmonella enteritidis that was causing illness in the individuals. This was a large outbreak that involved looking at shopper cart histories, that involved some process changes in getting that information faster, where we worked very closely with an unnamed industry partner in this investigation, and they changed their process in order for us to an answer faster, which was amazing. This actually developed into a New York State case study, which you can find here on the New York State Food Safety Centers of Excellence website if you want to learn more about it and the process, and you can go through the case study yourself. We're also revising the case study because back then we didn't have whole genome sequencing. So we're now working on making a revision to the case study to, let's say if we did have whole genome sequencing, to use it as an example. The two outbreaks that we went over earlier are other success stories of investigations where shopper cart history helped us identify the possible source and get it remove a product from the shelf. So here are a bunch of partners I'd like to acknowledge: our CDC SNET partners, our USDA, CDC, FDA, our federal partners, our local health departments. A lot of our outbreaks are involved with our New York City Department of Health and Mental Hygiene staff, other state DOH staff, the New York State Integrated Food Safety Centers of Excellence, and obviously our New York State Department of Health. It's always great trying to get answers to some of these outbreak investigations. And at this point, I think we have time for questions. I'm hoping I didn't go over.
You did not go over.
All right.
And let's see. So I would start with a question real quick, and I'll scan through the chat box. But so while we have inspectors educating while we're regulating, we now have preventive controls in place. Does the Department of Health have some type of outreach to now work on the consumer end of the education portion? So like Betsy had said, is it possible that it's raw turkey? Did all of these people literally like cross-contaminate themselves? Is there anything that you have, maybe communities, community meetings, someone represents? Just a thought, question actually.
So it's, there are ways that we try to do it. We don't succeed at it often. One of the things that's tough for New York State is we are a home rule state. So it's up to our local health departments or those that are in direct contact with the consumers. They're the ones that would put out these messages. We do tend to try and put out messages and put out consumer information through, what do I want to say? I've always, because I don't use Twitter, but that's, I forget what it's called, but we try to send out tweets through Twitter. We put out messages through Facebook. We try to tackle some of the bigger issues with that in regards to barbecuing during Memorial Day weekend. We'll put out those messages to remind consumers. We'll put out other messaging in regards to, when Vibrio season starts, to, beware of consuming raw shellfish, or if you get illness, because there's some attitudes and some behaviors you can't change. People that eat raw shellfish are still going to eat raw shellfish. People that eat sprouts, God bless you, I don't know why you eat those things, but they're still going to eat sprouts. And we see a number of our outbreaks associated with sprouts, and it's just constant. And we've put out information. The other big thing we're seeing, and it's not even the consumers, it's also the food industry. We just had another recent outbreak that we were involved in associated with chicken liver. And nobody in a restaurant likes to fully cook chicken liver. So we worked out with USDA and several other states and put out some guidance on how to properly prepare chicken liver. And in this recent outbreak, USDA put it out on their Facebook page and on Twitter, to try and get to the restaurants with that information. Right now, again, it's been very difficult to get additional information out there too, because of the COVID times we're dealing with.
Right. Well, thank you for that. Someone just asked a question about how many of the 17 dairy outbreaks were traced to raw milk or raw milk in cheese.
So a majority of them are associated with raw milk and cheese. A number of them are There's probably a good handful. I have to look back. I used to provide this information at Casey McHugh, but I haven't looked back that in a while in milk control for ag and markets. But we may be able to pull and see how many of them were specifically associated with the consumption of raw milk. There's probably a good, I want to say 25% of them, off the top of my head that I can remember. But several of them are associated with raw milk being used in cheese products.
Thank you. Early on, we had a comment from Betsy saying how there was an outbreak in Geneva, and unless they're scientists, are they not willing to give their fecal samples? But so Betsy says fecal samples, but also known as what? Poop in a cup, right?
Yeah, poop in a cup.
Well, as somebody who donated the poop in a cup, there is some real skill set to getting your poop in said cup. One of the sample containers was a very odd shape, but I did think it was funny when David said people don't like to give fecal samples, because that popped immediately into my head that the health department lady had told me, like, you can stop now, we've got enough.
Maybe a little webinar, right? A little educational webinar on how do you get that sample?
So interesting. I will say one of the things that came out of that outbreak, maybe you all won't find this interesting, I would love David's opinion on it. A colleague of mine was involved in an outbreak in North Carolina, and as a result of us both being involved, one of the conversations we had was, what came in your fecal collection kit? And it turned out what we both got in our fecal collection kits were very, very different. And the kit that I got actually had a tray that you taped onto your toilet to catch the sample. And my colleague in North Carolina, and this is true, ended up pooping in his salad spinner because they had not given him a tray. But the reason I bring this up, the salad spinner is hilarious. Yes, that is funny. But the reason I bring this up is it really struck us that it was odd that there is not a standard collection process, right? Or whatever. And I don't know if you want to comment on that, but it really did strike us as unusual that this was one of the things we recognized in our own experiences.
So we are changing that. In New York State, if this was, in the most recent, last 5 years or probably even a little bit longer, that kit that you had was likely something I put together. We do send out a kit with 2 vials. There's a clear vial and a vial with pink media, which is enteric media, also known as Kerry Blair. You should have received a white, what we call an upside down hat looking type reservoir that you tape to the toilet seat, and it's got a set of instructions in there on how to collect it and how to scoop it and how much to put in the vial. We've worked with several states to help develop that, and we've been sending those out for years. There also are some videos out there through the Food Safety Centers of Excellence on how to provide a stool specimen. Well, I think everyone knows how to provide one, but how to collect it and put it there. But one of the other stories I like to tell during some of these talks, and I know I had to have told it at other Association of Food Protection meetings, was we had this big peanut butter outbreak several years ago, and there's a person in my building that thought they got sick from eating the peanut butter. So all of a sudden I show up to office and there's a container in a bag on my desk says, "David, please call me." I called the guy and he didn't answer. Wait 10 minutes, call again, he didn't answer. Wait 10 minutes, he didn't answer. I look at the container, it says, "I can't believe it's not butter." So I have no idea. I open up the lid at my desk and it was his stool specimen, because he thinks he got sick from eating peanut butter. That was part of a multi-state outbreak, and he thought it was right to bring his stool specimen into our office where we have no lab and put it on my desk and see if I could do anything with it. So I gave it the sniff test and he didn't have salmonella, but I didn't know how that was going to work in the lab, but we'll see. But yeah, so I did what any state Department of Health employee would do, is referred him to his local health department. And he was able to actually get a stool specimen provided in the right way. And I don't know if he was ever positive or not, but it's amazing what people do to try and collect their specimens.
Well, I do think though, again, kudos to New York for our kit that was quite functional, right? It had what it needed. The only thing I was really unhappy with was the 1-2 was the poop kept coming out because of an air issue. But we actually had the pieces and parts that were relevant. In the case where you don't get something to poop into, that really creates a bit of a dilemma, right? Enter the salad spinner. And I would just at this point like to say, never buy a salad spinner at a garage sale. But yeah, so kudos to you for doing that. And I do think as a scientist collecting samples, yeah, having a standard collection method, I think is really, really important. So good job, New York and David.
Yeah.
But it was interesting to me that there wasn't a standard.
Yeah, and it's changing to be more of a standard now. I mean, our kit that we developed was based off of a paper written by Tennessee that looked at the before a health department person would drop off a kit or make you go into the health department and provide the specimen. Now there are these do it at home kits, and you can call the health department, they'll come pick it up. We're also been working with another group through the Council for Investi in developing some more guidance into use of a stool kit and what should that include. So we're hoping that a standard is going to be used by all the states, but to try and get all the states to do something the same way is almost impossible, but we're working towards it.
Great. Do we have
Hey,
any more?
David,
Go ahead. Go ahead.
David, it's John Luker. How you doing?
Hey, John, how are
Good
you?
to be here. Hey, I found it curious when you said, I think it was 2006, the number was of investigations was low because of H1N1. And I'm wondering, do you think that's detrimental to the food industry or food safety in general when, like you said, you made a comment that you don't have staff to do investigations because everybody's busy with COVID? I mean, we know that the food illnesses are still occurring. We're just not able to investigate them as much, probably. You think that gives people a false sense of security about food safety when the numbers are low because of that?
I don't think it'll give them a false sense because I think the data is out there that why the numbers are low. There are some reports out there of why that happened in 2009 because of H1N1. But the thing is also that, outbreaks were investigated when they were reported, but the issue was that they weren't getting reported. Not a lot of people were going to doctor's appointments during COVID, and they weren't going to go to a hospital or to an emergency room to provide a stool specimen. So were they happening? I mean, there's going to be a number of factors in this pandemic. So is that also why we weren't seeing so many foodborne outbreaks? Because there weren't a lot of restaurants that were open that were going through some of those issues. There weren't a lot of, our food supply was, for some places were scarce. So there weren't a lot of different foods that people had to change their diets or change things that they ate. But I think also because if they did go to the doctor and they did complain, they were still being investigated. But that was also impacting the consumer as well in their options, and that may have had an impact on it as well. But I think, yes, we were low on resources, but we did do what we could do. And that's not only our agency, that's even our federal agencies or other state partners. We're in the same boat. But if an investigation was reported, it was investigated.
So are you anticipating a spike in 2022? Possibly, or because people are going to restaurants or people will be going to the doctors? I mean, is that the way to look at this, or is it just the way it falls out? It really doesn't, I guess there's not much you can do anyway.
Yeah, I think it's the way it falls out. I don't think we're going to see a spike, but I think we're going to, obviously see an increase from that time period, kind of like what we saw in 2009. But then, it goes with the flow, and that with our increased use of technology, I mean, we're detecting more and more cases associated through whole genome sequencing. I've got numerous conference calls almost each day about different clusters that may involve a particular food I just can't find yet. So I don't think we're going to see a spike, but we are seeing a gradual increase with technology that was happening before COVID, and it's going to continue on.
Yeah, it will be interesting to see what happens now with all kinds of numbers that are going on out there when we do normalize again. All right, thank you so much, David. I appreciate your time once again. David did put up the last slide was his contact information, so feel free to reach out to David after the conference. If you have additional questions or concerns, I'm sure he will have no problem responding to you. Thank you again, David, appreciate it. And feel free to stick around with us or go out there and enjoy your day today. Thanks again.
Thanks. Well, thanks everyone. And it's always great to.
Yeah, you too, David. Thank you. Hope to see you in person next year.